Recording.
Good morning and welcome to the Morrissey Institute. I'm Dr. Michelle Morrissey. Here at the Morrissey Institute, we offer EMDR basic training, EMDR advanced trainings, consultation for certification and consultation for approved consultant status, as well as PRN consultation. As you need, you can request consultation. Of all the people out there, you probably look at it and go, why her? Well, let me tell you, I've been doing EMDR for over 15 years. I've been teaching for over 10 years now, and I've been consulting for 11 years, I believe it is. I have specialties that I do: PTSD, depression, anxiety, traumatic brain injuries. I've developed advanced trainings on how to adapt EMDR for traumatic brain injuries. I'm in the process of doing an advanced training or developing an advanced training called Affect Management Skills Training, originally developed by Dr. John Omaha, and I have his permission to do a modified version of this. I have an advanced training called Connecting the Dots, and one that I am in the process of doing on interweaves. Why else for me? My success rates with clients are phenomenal. So they are about 80 at the low end, 80% with anxiety and 90% with depression and 95 to 100% with PTSD. So something I'm doing must be working for the clients. Okay, the other things about why me is I've been published 3 times using EMDR. Once using EMDR for a case on a child with severe separation anxiety disorder. Another time using the group protocol, the integrated group treatment protocol for first responders. And normally the group protocol is meant for people who've been in the same event or tragedy, where when I used it with first responders, they had all attended a different tragedy that stuck out for them. And I also won the EMDR award, research award for that, and I got a grant to finish the research on that. Also, recently I've published a book on interweaves and how and when to use interweaves, what questions to ask, and it's in an easy to read A to Z format. Chapter 1's an introduction to understanding interweaves, and then 2 through 13, there's case studies. It goes alphabetically from adoptions, abortions, affairs, all the way through traumatic brain injuries. Couldn't come up with U as unusual circumstances. And then I couldn't think of anything for Z. So even though it's A to Z, it's actually A to U, but close enough. So other things that I'm going to be doing is putting up videos that discuss the 3 M's of EMDR: the model, the method, and the mechanism. Another one will be on the 3 prongs: past, present, and future, why it's important to follow those. Another one will be on the 3 processing centers of the brain. I'll have another one on the 8 phases of EMDR, the targeting sequence plan, and why that is so important to get that right. Then future templates, and then to interweaves. And lastly, I'm going to post a video for people looking for EMDR therapy and not knowing who to trust or who to go to. I have heard a lot of horror stories, not only from clients, but from consultees, where EMDR was done incorrectly, or they were improperly trained, or they interpreted the information wrong, and clients had very bad experiences. So the last video will be on questions to ask your prospective therapist about their experience, their success rates, all of that. So then you can watch that and you can know and interview somebody to ask. Interview, yes, because you are paying them for a service, and you wouldn't pay a doctor for shoddy service, or a mechanic or a plumber or an electrician. So know these questions before you proceed. All right. If you like this, please like the channel, like my channel, subscribe to it, pass it on to other people, and I look forward to posting more videos and hearing your comments. Thank you very much, and welcome to the Morrissey Institute.